Hello and welcome back to the Ready to Roll podcast. This week, my guest is Dr. Susie Spurlock. You may know her as Dr. Susie Squats on Instagram, and we talk all things about training around your cycle, strength training for women, training with hypermobility, and a lot more. This episode was super fun. I had the best chat, and I hope you enjoy it as much as I did. Let's get started. Thank you very much for joining me. Stoked to have you. Susie Spurlock, right? Your last name's not
Yes.
Squat.
Okay, so that is the running joke between me and my husband because we wish our last name was Squats, and we've actually talked about should we actually just change our name to Squats and legally just do it because everyone already thinks my last name is Squats.
Dr. Squats, though, like
I know, right? It's great.
So good. Introduce yourself. So I'd love to hear like what you do, what you are, what brought you to where you are.
Yeah, so my name is Dr. Susie Spurlock, not Squats, and I am a doctor of physical therapy, a strength coach, and an educator who is based in Charleston, South Carolina in the USA. And I own my own online rehab fitness coaching business with also a group strength training program as well. And so my love for movement kind of started when growing up, I was playing soccer. And my love for strength training also started around that age because I was made fun of a lot for being so small and frail and skinny, and I hated it. And so since I just loved exercise so much, I was like, I want to find a career where I can do this and do this well. So I got my bachelor's in exercise science, and that's really when I started to dive a little bit more into lifting weights during university. And then I obviously got more serious when I was in PT school. And that's why I also started my Instagram account and started posting educational posts, workouts, kind of a little bit like your typical fitness influencer, which I cringe at. But, you know, we all start somewhere and we grow as we go, right?
Yes.
And so after graduating from PT school in 2020, or physio, as you guys probably know it, over on that side of the world, I treated in an outpatient-based hospital clinic for 3 years. And within the first 6 months of that job, I was like, oh my gosh, I don't know if I can do this for the rest of my life. This is not what I was expecting this was going to be. Yeah. I saw a huge gap and the need for rehab and training to be married together instead of separate. Because you go to a physio, usually a lot of times they're good at a lot of the lower level stuff, some of the modalities like the ice, the ultrasound, some dry needling, which yes, some of this stuff can be helpful in its own, but unless you're addressing the training aspect, a lot of these more active people are never going to get back to what they're doing because they graduate physio and then they're like, okay, great. I don't have pain with my daily life, but how do I get back to training?
Yeah. Yep.
And I'm not sure how the education is over there for physios, but here in the States, we don't really get any education on strength training, loading, programming, any of that stuff, which is wild to me. And it's probably wild to you too.
Yeah. Well, I also have a bachelor's in exercise science, but that's where my education finished. But I saw the same gap, to be honest, which is why I didn't pursue physio. I started doing a master of physiotherapy, and I was like, there's no. I was like, I'm not going to pay another 80 grand for this. Thank you very much. I'm just going to, just keep with my bachelor's. So I saw the same gap, and I was like, how do people then get from their little external rotation with your band to back to whatever sport it is that they're trying to get back to? So yeah, exactly. I love that there are physical therapists or physios like you out there, and hopefully there'll be more coming.
I feel like it is taking a shift over the past 5 years, I would say. But the problem is, I know over here in the States, until the schooling changes, everything's going to stay the same. Right now, they just basically, the program is made for us to pass our boards, and then that's it. So until they have internal changes within the programming itself, it's probably going to stay where it's at. And just those small groups of people that are super passionate about this stuff and really passionate about just helping people and learning as much as they can, it's going to kind of stay the same. But that's why they have people like you and me. I mean,
Yeah. I love that. Yeah, I love that so much because that gap is just insane.
Right.
So let's move on to talking about strength training and talking about, I'd love to hear your opinions and thoughts on why, particularly for women, strength training is maybe beneficial, maybe required, whatever your sort of thoughts are around that, I would love to hear.
So my opinion is that it's required. It's 100% required. You need some sort of strength training or resistance training or some sort of training where you are putting external load on your body. And I could go into the semantics of the difference between strength training and resistance training, but for the sake of this podcast, I'll just focus on the reasons why I think it's a non-negotiable. So number one is bone density. Osteoporosis is affecting nearly 1 in 2 women over the age of 50. And usually starting around, I believe it's age 30, bone mass starts to gradually decline. And women can lose up to about 20% of that bone mass or their bone density within the 5 to 7 years post-menopause due to that severe drop in estrogen. And then after that, the bone loss kind of goes at a steadier rate, but it's still happening. So the bone density changes. It's not a later problem like, oh, I'll start doing strength training whenever I get to be in my 40s and my 50s or after menopause. No, like it's a now problem.
Like, let's do it now.
Yes, if you're around the age of 30, like you need to start the preservation process of that bone density now, because with osteoporosis, I mean, like I mentioned, it does have a significant hormonal influence, especially when we're looking at peri and postmenopausal women, where those decreased estrogen levels have a negative impact on that bone formation, since they basically increase the sensitivity to the breakdown of the bone by one of your hormones called the parathyroid hormone. And the scary part of osteoporosis and why this is so important is because it doesn't really have any clinical signs or symptoms until there's a fracture.
Yeah, true.
Or until you go and get a DEXA scan because you're in that menopausal age range. And so most of the time, women don't really know how serious their osteopenia or osteoporosis is until they break a bone.
Yeah, which can be like life altering if it's something like a lower limb, you know. Which is,
and this is, you know, it's not uncommon to kind of see this because traditionally, like through societal standards and just gym culture and fitness culture and diet culture, women are usually told to stay small, stay dainty, and frail, to be quite frank. Stay away from the heavy weights, stick with your low resistance Pilates and your walking and your cardio. But none of these things, although they are great ways to move your body, none of these things are going to have the impact on bone like actually using some external load does.
Yeah. And that kind of like, so recently I follow this person on Instagram who has a very large following, and they did a post recently about impact training and how, you know, you're not an athlete, you don't need to be doing things like this. And it was just basic plyometrics. And I had a rant in the comments section, and I was like, this is so bad. Like this is potentially very detrimental to all of these women. And like, you know, like you have such a big platform. Why are you spreading this rubbish? Essentially, obviously plyometrics, everyone's not going to go straight into like insane bounding or like depth drops or something, but like you should be doing impact training. And anyway, that comment also blew up a little bit on Instagram. But it's so interesting. I love that you say that because like we need that impact and we need that resistance and strength to be put through our bones to help with the offset of osteopenia and osteoporosis.
And I'm happy you brought up plyos because obviously, you know, we were kind of talking towards strength training, but to note on plyometrics, every woman should be doing plyometrics. Even if your program is strength focused and your goal is like, you know, increasing your 1 rep max, getting stronger, building muscle, your program needs to have some sort of plyometrics in it, because guess what that helps? It not only helps like your tendons and your connective tissues, but it also helps create robustness around your joints. And as you get older, this helps decrease your overall fall risk because you have quicker reaction times. So not only does strength training increase the bone densities to decrease a fracture, but the plyometrics increases that coordination and response time so you don't fall in the first place.
Yeah, exactly. I said this to someone the other day and I get so like passionate, I guess, about it. And like someone had, I think they had tripped over their toddler or something. And I was like, this is why women need to be doing strength training. I was like, maybe she would have still fallen for sure, but also maybe she wouldn't have. And maybe she would have had better coordination and balance and not resulted in the tragedy that occurred. You know, so like, yeah, I definitely love that. So if someone, let's say someone doesn't want to pay for a program from a coach and they just want to get into some plyometrics, or they want to add some plyometrics in themselves, but they've never done it, what would you recommend they start with?
So I love to dose in some plyometrics right before your main compound lift or your main movement of your strength training session, because not only is that going to sneak some plyos in there, but that's also going to tap into something called post-activation potentiation. And you don't need to know these words, but basically it kind of taps into those fast twitch muscle fibers, which are actually going to help get you stronger for your main lift of the day. So there's that benefit. But if you're looking for starting off on plyometrics, if we're thinking of or talking about the lower body, some band assisted pogo hops where you loop a band around the squat rack or a pull-up bar, and you're holding on to the band and you're just doing hops in place, can be so beneficial because you're getting that impact. You're starting with the plyometric movement, but you also have the band to kind of help take up some of the slack when you are landing. And then if we're talking about upper body, I love the use of med balls for upper body plyometrics, whether we are shoving them and tossing them towards the ground, whether we're doing rotational movements and tossing them side to side. And another one of my favorites, it's basic, but it's great, are just some bench plyometric push-ups where you set up a bench, you're pushing up to where your hands come off the bench and then absorbing your force on the way back down. So there's so many ways to incorporate these to where you don't have to do a whole entire plyo section.
No, exactly. And that's exactly how I program for my clients and athletes, is they've just got a bit at the start that just is, obviously makes sense for the workout that's to come, but they're not, like my athletes in particular, are not people that are running and jumping and sprinting and bounding and whatever, but they do still benefit a lot from these plyometrics. So that's great. I hope everyone's taking notes there on how to add in some plyos.
Yes, and then there's other times where in my group strength training program, even like clients programming, we'll do like a little bit more intensive plyometric block. So if we just came off a heavy strength block where we're doing a lot of bilateral movements, working in the sagittal plane or the plane that you're working in for squats, deadlifts, and the majority of like all movements, I'll toss in something that's called contrast training. So where you're doing a resistance training exercise, let's just say we're doing a barbell reverse lunge. And then instead of resting, you're actually going to go into some split squat jumps right afterwards until you sort of hit that muscular fatigue, and then take your rest and then repeat again.
I love contrast training. Because I wasn't someone who did plyometric training until really the last 12 months or so, and I'm 41, it fries me. Like the adaptation that's occurring is crazy. And I'm like, oh, okay, I actually need a little more rest between my sessions for this one, which is great. I love it. But yeah, it's great. Yeah, so good. I'm glad that you said contrast training, because that's like one of my faves.
I know, I love it too.
And so while we're on the subject of why women should be strength training, it's a non-negotiable, let's talk about training around your cycle, because a lot of the time I find that women will plan, and for anyone who's not watching and just listening, I'm doing inverted quote things, plan to feel bad in their luteal phase. And so they will plan to only do those low impact, low resistance exercises like Pilates and yoga, which by the way are fine, they have their place, but they choose to only do them. And it's almost like they're planning that. And I just think you are losing half of the time that you've got to make gains. But your thoughts?
I definitely agree with you. Just because when we look at the menstrual cycle from a like bird eye view, no women's menstrual cycle is the same. We all have different symptoms. We all feel stronger at different points. I myself hit most of my PRs during my late luteal phase, which is where you're supposed to be just doing the R&R and light yoga.
How dare you?
So,
you were strength training your late luteal phase.
Yeah,
How usually
I know, right? How have I not internally combusted and my uterus just splatter all over the wall, right? But with that being said, I definitely have some clients who feel a lot weaker during that later luteal phase, where we have that drastic change in our hormones, where in that case, I'm still not telling them to do, only stick with light walking, light yoga, light Pilates. Because when it comes down to it at the end of the day, if we did true cycle syncing, which is where 2 weeks out of the week, we are pushing a little bit harder when our hormones are at those better levels. And then 2 weeks out of the week, we are doing that low intensity. You're never going to make enough progress when it comes to the changes with bone density, muscle mass, and overall strength. Yeah. You do not have to overhaul your program for your cycle. What you should be doing instead is using intensity-based training, which you can use rate of perceived exertion, or the inverse of that is reps in reserve, meaning RPE is kind of how difficult a set felt for you from 0 to 10. And RIR is just the flip side of that, of like, how many reps do I think I have left in the tank? So if I rate the effort of a back squat set an 8 out of 10, that would mean RIR would be a 2, where I have about 2 reps left in the tank.
Yep.
Because guess what? Our body doesn't know how much load is on the freaking bar or how much load we're lifting. All it knows is tension. And that mechanical tension is achieved by lifting closer to failure within that 2 to 3 reps. So instead of overhauling your program, if you're feeling a little bit weaker, maybe let's not lift as intense. Maybe let's leave about 4 reps in the tank, maybe even 5 reps in the tank if you're super crampy and super irritable and just want to go cry into your dog's fur and eat a bunch of chocolate. But
which is fair.
Yeah, which is fair. But we are still training throughout the different phases of our cycles.
100%. And I've done a little bit of research onto this, and I do remember reading one particular paper, and it was comparing our actual strength throughout menstrual cycles, and it doesn't change. Like, the strength of our muscles doesn't change. It's mostly like a motivational thing that occurs. So and like, tell me if you don't agree with this as well, but I generally say to my female clients, like, train how you feel on the given day. You know, like, some days you'll go in there and you'll feel like a bag of dicks, but you'll actually start training and start moving really well. And the flip can happen as well. You can go in there and feeling great, and then, you know, suddenly everything starts hurting or just doesn't feel great. And it's like, so you, like you say, training to that intensity thing is going to help you continue training throughout your cycles. And like you say, not every woman's cycle is the same. Even like when you compare your own cycle with your own cycle, you know, like this month versus last month I, you know, felt horrible. This month I feel great, you know, no changes. So I think that's a really important lesson for women to learn.
Right. And I'm not sure, we might be talking about the same paper, because there's a paper that I always pull up when I get questions about cycle syncing. And basically they looked at all the different factors that can affect how a woman feels on her cycle. And basically there really isn't current evidence to support that cycle syncing training or that doing cardio is harmful during any phase of the menstrual cycle. But what women are missing is like the forest and the trees, because the things that are going to impact how you feel on your cycle is less about what phase you're in and more about how are you managing your recovery? Are you following a shit program that is just burning you out from day one for the entire block? Are you sort of modifying your intensity based on how you feel? Most women think that they either have to go balls to the wall for every session, or they're afraid to push into the intensity that makes them a little bit uncomfortable. And then a huge one is nutrition. My God. Back on the diet culture thing, women notoriously underfuel. They underfuel on total calories. They're afraid of carbs. They don't eat enough protein, and they don't eat enough fiber. So if you're feeling like you said, a bag of dicks on your cycle or throughout these different phases, don't just scapegoat and blame training as the boogeyman or your hormones as the boogeyman. Let's look at your lifestyle decisions based on nutrition, getting enough calories, your sleep, and what program you're following, because odds are those things are going to have a much more massive effect on how you feel than just avoiding any higher intensity programming to begin with.
100%. And on fueling as well, like, I was always someone that couldn't eat before I trained for a long time, and then I started eating before I trained, just some simple carbs and a little bit of protein. Oh my God, the differences in my output and my endurance throughout my session. I was like, there's something to be said for this, you know. And that was probably like, I'm going to say about 6 years ago, I started actually properly thinking about my fuel for training sessions. The difference is night and day, you know, so don't go into your sessions with an iced latte or a matcha and think it's enough.
Yeah, ice lattes and matcha, those are not breakfast and those are not fuel. That is a drink. Please, my God, eat something, even if it's just a banana with some nut butter.
Literally, yeah. And that was what I used to say. Like, a lot of the women at our gym would ask me, and they'd be like, I can't stomach it. I'd be like, that's okay. Just like bring a banana and literally have half of it. Just have a little bit, like a tiny bit, and then we'll work up to being able to have a bit more before you train. Because I get it. You train at 5 a.m. It's hard. I don't want to eat at bloody 4 a.m. either. You know, but
no, I wouldn't either, even though I'm still asleep at that time. But
yeah. It's funny about the diet culture thing. I saw something on Instagram yesterday that I was a bit shook. I've noticed, I don't know, I'm a bit older than you, so I sort of remember the 90s quite well. I was in high school, and the whole Kate Moss era of being super skinny and having a ciggy was pretty big. And I think it's back. I think we're back to emaciation is cool again, which is such a shame because muscle mass is cool, guys. Muscle mass.
Yeah. And, you know, you are not seeing things. It's actually a thing. There has been a hashtag going on around TikTok. I'm not sure if you're on TikTok, but it's called hashtag skinny talk. Basically, all these women giving tips on how to slash calories, drop weight really low, lose all muscle mass, be thin, be frail. And although there's nothing wrong with having a smaller body size, aiming to just totally malnourish yourself to fit a societal agenda with diet culture and develop disordered eating habits, because that's what it is. You're developing disordered eating habits is not good for your body. It's definitely not good for your menstrual cycle because you're probably going to lose it. And it's also not good for your mental health. So
yeah, definitely. And like the girls that are probably following that mostly, I'm going to guess, are going to be teenagers and women in their early 20s. You know, it's yeah, it's not cool. I mean, I was like that. Like in the 90s, I did the Special K diet. I didn't do the grapefruit diet because I didn't like grapefruit, but you know, I would be proud of myself when I wouldn't eat. What is that? It's insane. And like, I didn't even have Instagram or social media. So I really do feel for these girls who are being fed skinny talk. Oh,
yes,
God.
I know. I can't even imagine growing up this day and age and being that just so impressionable in your teen years and early 20s. But the good news is, I just read this, I think yesterday, the day before, is that TikTok saw how detrimental this is to women and they actually banned the hashtag skinny talk. So
Did they? That's
yes,
good.
so that is a very, very good step in the right direction, which I applaud them for that. But we're still seeing the same topics kind of come up. But like you said, muscle mass is so freaking cool. It allows us to do so much stuff.
It's so much more fun.
Yeah. And women already tend to have less baseline muscle mass than men. So the loss that starts to happen when we hit age 30, because we start to lose around 3 to 8% of our muscle mass per decade after the age of 30, unless, I know it's so sad, unless we like actually strength train. And one of the biggest reasons why women don't get into resistance training for muscle mass is because of the societal messaging that traditionally has discouraged women from lifting heavy or prioritizing muscle mass, eating. And so, I mean, I've seen positive changes start happening on that. But then, like you said, all this new stuff that's coming out from this younger age generation is kind of unraveling all the hard stuff we worked to build.
And this was a well-known clothing brand was the thing that I saw, and I was just like, oh man, come on guys, you know, it's just horrible to see. Excuse me one moment while I get my naughty little puppy.
Oh, yes.
She can just go in air jail for
so
a moment. Yeah, she's naughty. Sorry,
she's so cute.
She is cute.
Oh, hey, sweetheart. Mine are locked out of my office because they would be all over me right now.
Yeah, well, if I lock them out, they just scratch at the door and bark. But if I let them in, I have to be sitting in here like 20 minutes before I do anything that I'm recording so that they can get it out of their system. But anyway, it didn't work, did it? Anyway, back to the agenda. So you go on.
So the funny thing about the whole like skinny talk, getting smaller, not gaining any muscle, but also like following cycle syncing to a T, it's kind of counterintuitive because guess what is the one thing that is involved in regulating blood sugar, glucose metabolism, and helping you prevent conditions like type 2 diabetes and heart issues? It's having muscle mass.
Yeah.
So if you want to feel good and age well, you need to be gaining some muscle mass, especially because there's a correlation between muscle strength and longevity with individuals to maintain muscle mass, living longer and healthier lives. Like this is decreasing your risk of all-cause mortality or death.
Yeah.
So you need to have some mass.
Yeah, I know. And I think as well, you know, I don't want to get bulky thing. I thought that was finished, but apparently we're not done with that. I think women over or underestimate, I'm not sure which one I mean, how easy it is to get, like, if it was that easy, I would be bigger than I am. I would have bigger muscles than I currently do if it was easy to build muscle. Every single little millimeter of growth that I get is a lot of work and a lot of food and a lot of, like, it doesn't just accidentally happen. You don't just like, oh my God, I got bulky, oopsies. Like,
no, it doesn't. It takes so much effort to build muscle. But what I think happens is, since women are so used to seeing the smaller version of themselves, even a small amount of muscle gain, they attribute that to, I am getting bulky. And so at the end of the day, that is more of a mental health, psychological, maybe body dysmorphia, eating disorder kind of habits, more than it is an actual, like, oh, she got bulky sort of thing.
Yeah, I know. It's crazy, which is, I guess, where the Pilates comes in. And don't get me wrong, I love Pilates, but you just need to be doing strength training as well. I'm not telling anyone to give up their Pilates, but just add in some strength, please.
I made people mad when I made a post about that. A couple months ago. And it wasn't even like, oh, Pilates is crap, don't do it. I said Pilates is great for XYZ, muscle endurance, core stability, mid-range muscle strength, the community that you have with classes, a way to have low impact exercise. But it is not strength training, and it will not yield the results of the increase of bone density and muscle mass, period. And the Pilates cultists, and I'm not saying everyone who does Pilates is a cultist. I'm talking about the people that eat, live, breathe, die Pilates. They got mad at me. And I'm like, yo, I literally just said your preferred form of exercise is Pilates. And I do it once per week. And I also don't like running or cardio, but guess what? I still do it because it benefits my health.
Yeah.
So it's just wild how tied people get to a certain form of exercise versus realizing that there are so many benefits of all the different kinds, but strength training is a non-negotiable.
Yeah, 100%. And it's so funny because people are the same with diet, right? Like, no, it's got to be carnivore. No, it's got to be vegan. It's got to be vegetarian. It's got to be sugar, the new sugar diet. It's got to be all these things. You're like, or hear me out, eat it all. Just
have it all.
Be dickhead about it.
I usually tell clients, if a diet has a specific name tied to it and you are not on it for a medical reason under the supervision of a medical provider or a registered dietitian, then it's probably bullshit. Yeah. Except for the Mediterranean diet, because that one honestly allows you to eat multiple different food groups and has some really well-backed research to it. But all the other ones, no. Yeah. Just no.
Just eat your protein, eat your veggies, get your fiber, have some carbs and fats, and you're good to go.
Yeah, and have a donut every once in a while, or a slice of cake. Like, come on now. We are not cutting out entire food groups, but we're eating majority of nutrient-dense foods and making sure we're getting protein, fiber, carbs, and fats, and then having some of the less nutrient-dense foods along to keep ourselves happy and sane.
Yeah, I know. It's not that difficult, but apparently it is.
Apparently.
I think it's all just sales and marketing, though, to be honest.
I agree.
Yeah. So let's talk about, I'd love to ask you about hypermobility while we're talking about somewhat sort of about women in strength training, because I find I get a lot of questions from women who are hypermobile, and they either seem to be hypermobile and stiff, which results in dislocations of, let's say, a shoulder, or they're hypermobile and flexible. So I would love to hear your sort of, I guess, approach to these people and training.
Absolutely. So for anyone listening, I myself have hypermobile Ehlers-Danlos syndrome. So I am a bendy human, and basically you can have something like EDS, or you can have hypermobility spectrum disorder. And both of these things are kind of like on a sliding scale. So I'm actually a really high functioning person with EDS. There are some people that are basically kind of bedridden because of it. And so just because one person with hypermobility disorders you see doing really well doesn't mean that you have to be like them or push like them. So I really want to put that out there, because that's kind of a big common misconception when it comes to this stuff. But basically, hypermobility disorders, it's a connective tissue disorder that's commonly known for laxity in ligaments. And so because our ligaments, which are basically kind of help holding our joints together, are stretchier, we are susceptible to joint dislocations. And because of that, our body and our nervous system tends to be in overdrive in order to tighten up muscles around those joints so that they don't dislocate. And that's kind of where we see the stiffness, but also the hypermobility kind of occur together. I have heard time and time again from doctors that I've seen throughout my life, and as well as clients, that they've been told to not strength train because it's dangerous for people with hypermobility.
Really?
And I'm here to tell you that strength training is your golden ticket to feeling a heck of a lot better than you are, both from stiffness, confidence, proprioception, which is like knowing where your arms are at in space. Because if you're someone who's hypermobile and listening to this, we wreck into walls like on a daily basis and bruise ourselves because we don't know where our limbs are at in space. And it's also really magical at helping decrease your pain too. And so we need to be strength training. It's not just something that should be part of a routine or something that you should consider doing. It's basically like a literal lifeline for these populations.
Yeah. I love that. Is there anything, like, are there any contraindications or anything that, like, anything you would tell someone who is hypermobile not to do?
It really is person dependent and case dependent. So the most common joints that we kind of see with dislocations are shoulders and hips. With both of those, if someone has a history or recurrence of shoulder dislocation, I'm probably not having them go into a super deep chest press with a lot of shoulder external rotation, because that is what puts a little bit more stress on the anterior capsule of the shoulder. And stress in itself is not inherently bad, but when you have a history of these subluxations or dislocations, we kind of want to avoid those end ranges of motion to start. And kind of the similar thing when it comes to the hip, I'm usually a little bit more weary to do, Copenhagen planks with your ankle on the bench, because that's a really long line of force, at least to start. But mainly, again, if someone has had a history of these dislocations. Yeah. So there's really no exercise or movement that's off limits until we kind of go through your history and kind of see where you may have had these.
So it's just loading and being sensible.
Yes. And with hypermobility, we want to stop stretching. That's number one. Please, for the love of God, stop stretching.
You mean when you say stretching, are you talking about static and passive stretching?
Yes. So static and passive stretching, please stop. Because what you're doing is, I know you're searching for relief. I know you feel tight. So let's use the upper traps, for example, because that's a super common tight muscle in a lot of people with hypermobility. If my upper trap is tight and I'm constantly pulling and trying to stretch it on ligaments that are already stretched out and on a nervous system that is trying to tighten up that muscle to hold those joints together, you are literally just doing the opposite of what your nervous system is asking you to do. So instead of stretching, we are going to load through the full available range of motion that's comfortable for you. So for the upper traps, grabbing a dumbbell, doing a holding it in your hand and doing a shoulder shrug, bringing ear to shoulder. And then as you lower the weight back down, go ahead and do a side bend away from that shoulder, because now we're introducing blood flow. Now we are loading, and that external load is telling our nervous system and our body, hey, we're safe here. We're getting blood flow. So because of this, now we're going to relax a little bit afterwards.
Yeah, I love that. And so if someone's listening to this and they're like, oh my God, that's me, I'm going to go do that right now. Are they going to go pick up a 20 kilo dumbbell or a 1 kilo dumbbell?
You're going to start lighter, and you're going to start with maybe a 1 kilo dumbbell to see how it feels. I myself, I know since I'm American, I use pounds. I usually do it with like a 25 or 30 pound dumbbell. But again, I've been doing this for forever, which is about like what, 15, 14?
Yeah, but that wasn't your first time doing it with that weight though, right?
Right. I have worked up to this, because the last thing you want to do on a super bendy body is load it up really fast, really soon, when your body's not used to doing this. And that can further just irritate things. So start slow, but loading and resistance training and active dynamic mobility exercises are going to be your ticket to feeling better, not static passive stretching. Yeah, that's good. I love that. I asked that question about the load because I have had clients that are going to undershoot and overshoot for sure. Like in the past, I've had clients that have just either going way too light or way too heavy straight away. So it's nice to give them some idea for that one. Just start light and then slowly work your way up. And same thing, like if you go, I do a lot of loaded mobility, and it's like, you need to find the correct load, right? Like if it's too light, you're not getting any load through that
hypermobility. But if it's too heavy, your nervous system is going to be like, oh shit, no, and just freak out and start trying to protect, which is not what we want.
No, and that's brings me to another point too, is a lot of times with hypermobility, I usually love to have people start off using a slower tempo, especially for some of these higher loaded exercise. So tempo is just the speed at which you're performing a rep. And instead of like going super fast, if we're talking about a squat, for example, going super fast, kind of bouncing off the back of your calves and then coming back up, you are losing a lot of tension and control in the bottom of that squat. And for someone with hypermobility, we're actually kind of hanging on our ligaments and our joints down there while we're loaded. So we don't want that. We want nice and slow and controlled on the way down. Let's do like a 2-second lowering, a 1-second pause in the hole, and then a 1 to 2 second on the way up.
Yep.
And I've even gone so far to have people stop mid-range. So for your squat, instead of using your full range of motion, if you can't control it because of your lack of body awareness and proprioception, then we're stopping kind of mid-range, and then I'm having you come back up. And if you have hypermobile clients do this, it is so incredibly hard for them to stop mid-range in an exercise, which I'm sure you probably know.
Yeah. I do a lot of mid-range pauses and pauses in the bottom and lots of different tempos and stuff. And it is the hypermobile clients that hate me.
Yes, hate you but love you.
Yeah, exactly. Yeah, that's so funny. I love it. So far, I feel like we're just both on a little bit of a rant, but I love it. It's so good.
I do too.
So let's talk about injuries. So a current little bee in my bonnet lately has been the fact that even though old mate who coined the term RICE many, many, many years ago came out still many years ago and said that was wrong, it still seems to be so prevalent in the sporting and I guess fitness world, probably more sporting. When people ask me about it, I always say, look, ice is awesome for an analgesic effect if you need it at the time, but it is not good for healing your injuries. I would love to hear your opinions on that and how someone should try to heal an injury.
Yeah. So my thoughts are less opinion-based and more fact-based because we have science to support it. So little Dr. Gabe Merkin, I think it was back in the 80s or the 70s, I believe. He was the guy the doctor who coined RICE, rest, ice, compression, elevation, for any soft tissue injuries, which are your muscle strains or your tendon or ligament sprains, like an ankle sprain, or if you pull your quad during an exercise. And it was thought that, okay, if that happens, you need to RICE. And I don't know why the heck we are still teaching it, because Dr. Gabe Merkin himself recanted his original RICE back in 2015, 10 years ago. Yeah. And this stuff is still being taught. I don't know what sort of medical programs it's still being taught in. I know it wasn't taught to me 5 years ago in PT school, but I'm thinking it's maybe coming more from physicians or athletic trainers, and I'm not sure. So if you get mad that I said that, you're like, oh no, we don't learn that in school anymore, then please leave some comments on the podcast so we know that you're learning the good in your program.
Because that is what I was taught. However, I did finish in 2015, so makes sense.
Yeah, so right around that time where things were already starting to shift. Yeah. And so the reason we don't want complete rest is because we need blood flow to the injured area in order to bring nutrients to that area for it to start that healing process. We also need muscle contractions in order to contract the muscle and push all of the waste products of that healing process back up into the lymphatic system so they can be disposed of. When we are resting, neither of those things are happening, and you are delaying your healing point blank. The icing, like you said, you're right on par. If you like icing for that analgesic effect, go for it. But make sure you're not spending the whole day on a couch with ice on your ankle and then subsequently resting too much because of that. Yeah. Icing's also not going to help you heal faster. All it really does is penetrate down, I think, 1 centimeter or 2, maybe even just 1 centimeter into the tissues and help with some of that pain relief. It doesn't do anything to actually promote healing. Heat and blood flow is what's going to do that.
Yeah. Yes. No, I love that. Like, I was saying to the person who asked me about it yesterday about icing, I was like, rest is now, it's considered to be better to be relative rest. So obviously if you've hurt your ankle, you're not going to go for a run or a walk on it. Like you have to be sensible about these things. But at the same time, we also don't want you just laying on the couch for 3 days with your foot in the air and a and an ice pack on it. So it's about being smart, understanding that blood flow is actually the thing that we're looking for in order to help heal and move forward. And he was, I mean, I ranted for quite some time.
As you should, as you should. This is important stuff because, when he has that positive experience with this healing of his current soft tissue injury, he's going to go tell everyone else, oh my God, I didn't rest for the first time in my life after this. And I got back to doing what I love the most faster than I ever have.
Yeah.
And so we actually do have a new acronym. I did not create this acronym. It was actually created by Du Bois and Esculier, I believe that's how you pronounce it, with the British Journal of Sports Medicine. And the new acronym is Peace and Love. And you're probably thinking, Susie, that is a long ass acronym. And yes, it is. It's not as simple as rice, but injury recovery is not simple and it has a little bit more complexity. And so they do have a nice little downloadable PDF online. And I can also have you link it in the show notes too. But basically, peace is that first part, those first several days of after a soft tissue injury. So P stands for protection. So we want to avoid, like you just said, any activities or movements that really increase that pain during the first few days. Again, relative rest. We are not completely resting and laying off of our injured area. E is for elevation. So yes, elevation was also in rice because that C stands for compression and the E stands for elevation. We are keeping this because if we have an ankle sprain, we can elevate our leg above our heart, which is going to help with that lymphatic fluid drainage and those waste products kind of out of that injured area. Bonus points if we're talking about ankle, if you do some ankle pumps with it, because now we have muscle contractions with some elevation, getting all that stuff back to the heart and decreasing some of that swelling, because swelling can increase that pain response. You start feeling your heartbeat in your limb as you're trying to just hang out.
Yeah.
A stands for avoiding anti-inflammatories. And this one is probably the most controversial one within the Peace and Love acronym, but it's so important. People have demonized acute inflammation, meaning inflammation that happens, that is necessary for that healing process. They've demonized it, said it's bad, and allowing the inflammatory process to go through those 4 phases is the thing that's going to get you back to running, jumping, squatting, whatever, quickly. So we don't want to interrupt this. So if you are having pain to the point where you feel like you need to take medication, instead of taking your NSAIDs, like your ibuprofen, those things that are going to decrease the inflammation, maybe let's try and do something like Tylenol or some of the medications that can decrease that pain response, but still allow that inflammation to happen. You want the inflammation to happen.
Yeah. We have to move through it, right? Like we have to go through that response to get to the next stage of healing.
Yes. C stands for compression. Obviously, that stayed in there because compression is going to help with any increased incidence of swelling, which is going to help decrease some of those pain levels. And then E is for education. Like this is the point where people need to be educated by their healthcare, rehab, fitness providers, whatever, on an active approach to recovery. The passive modalities like the electrotherapy, manual therapy, acupuncture, lymphatic massage, early after injury don't really have significant effects on pain and function compared to an active approach where you are trying to basically move that injured area as much as you can without a super increase in your pain response. Yeah. So we want to get movement in there early and often as much as we can.
Yeah. Cool. Just within your pain tolerance threshold, I suppose, right? Yes. Like you're not going to be jamming your whatever it is through the pain and like grimacing going, it's good.
No. And if you keep testing it every day, like, I wonder how far I can push it today. You're probably pushing it past the inner tissue's current capability. That is going to delay your healing. Yeah. So we're not resting, but we're not just going gung-ho on all of our movements. We are finding that middle ground, the gray area, the nuance to where we can get a little bit of movement in for this process.
Yeah.
And then love, the second part, that is when things start to simmer down after those first couple days. L is going to stand for load. So let pain be your guide and a gradual return to some of your normal activities. And your body's going to kind of let you know when it's appropriate to increase next. So if you're feeling pretty good after the first couple days of using the piece, then let's go ahead and find some ways to load it, whether it's with some isometrics, whether it's with a band. Start with these lower level exercises first to kind of gauge how you feel, and then you can gradually sort of increase.
Yep.
O is for optimism. We are no longer wallowing in our tears when we have injuries. Actually, it's okay if you want to cry for a hot minute, but we're going to cry, we're going to get it out, and then we're going to flip the script and be more optimistic about our expectations that are associated with just better outcomes and prognosis. So if you
that's in there.
Yeah. So you need to find the positive, find a little sunshine, find your little glimmers of sunshine, because psychological factors such as like catastrophizing the experience, depression, and fear of movement can actually not only increase a pain response, but also just decrease your overall recovery. So your feelings are valid, but we are going to try and go through this with a little optimism.
Yep.
And then V is for vascularization. I've kind of already talked about this. Vascularization is just increasing the blood flow to that injured area. So some light movements, if we're talking about the ankle, some ankle circles, some ankle pumping, because that is what is going to increase the blood flow to the injured structures. And early mobilization is going to improve your function, and it's going to support returning to work or sport. And it's also going to decrease the need for pain medication when you're dealing with this. And then finally, the last one's E. It's for exercise, which is pretty, self-explanatory in my opinion, just because there is such strong evidence supporting the use of exercise for treatment of soft tissue injuries and reducing the prevalence of recurrent injuries. So there's a reason you injured yourself in the first place. So let's build this sucker up stronger than it was prior, so that your body's prepared to take on all the forces and the stressors and the things that you ask of it.
Yeah, that's very cool. I like peace and love. It's like even as the saying, you know what I mean? It's like we're going to treat our injuries with peace and love.
We're going to be positive about it. And like I said, it is a lengthier acronym, but the pictures that you'll find when you search and if you read the paper, it kind of gives a little blurb for each one of those to really just kind of help you jumpstart this whole process.
Yeah, very, very cool. Well, I'm going to wrap us up here, but before I go, I would love to know, have you got anything that you want to share with anyone that you've got coming up soon? I think I saw you've got a merch drop coming out soon. Anything at all that you want to sort of try to promo a bit? Let's have it.
Yeah, so the merch drop actually launched today, but the sad thing is it's only open for like the next 2 days until I send an order because it's all pre-sale, and shipping's only to US just because of how expensive it is to ship stuff right now. Sad, but
most of my audience is actually in the US, so that's fine.
Amazing.
But also, I'm probably not organized enough to edit and post this podcast within 2 days.
Rightfully so. So if you were like, oh my gosh, I love Susie's merch, just wait until the fall and I'll do another pre-sale and you can snag some stuff then.
Awesome.
But I think I'm actually wearing it right now.
Oh, cool, like MTV.
Exactly, but MYB for Move Your Bones, like my business. It's great. But I do have a group strength training program that's primarily women. It's like $37 per month, which is a hella steal, especially since you get group chat access to myself and my 2 other PTs that work for me. I also do one-on-one coaching for both rehab and fitness. And then because I love you guys so much, I'm going to have you link this in the show notes too. I have a whole entire free resources page on my website. Cool. And you can download a free 4-week strength training program that's for gym and home. You can download a guide on cycle syncing, which has all the science and what to do instead. I have one on intensity-based training to learn how to use RPE and RIR. If you were like, wait, what is that? And I'm interested in using that, but I don't know what the heck that is. I also have one about training with pain, where I talk about using the traffic light system and the ladder system to kind of get back to where you were before, and also kind of just diving into what pain is, because it can be really scary to a lot of people.
Yeah.
And then I have a warm-up guide, how to target warm-ups for performance and to not spend 20 minutes rolling on a piece of foam. And then finally, exercises for a tight posterior pelvic floor and glute growth. So all of those are free. So if you like some of the stuff that I talked about here, be sure to go and download those. And yeah, I'm happy to connect with anyone who listened.
Yeah, that's awesome. Well, I'll put all of those links in the show notes. And yeah, get on it, guys. Susie, very smart lady. So
thank you.
Get involved. But thank you very much for joining me today. It was awesome to chat, and yeah, even though it was probably more of a little bit of a rant from both of us, but
it's fine. It's fine. I love it too, and thank you so much for having me on.
Thank you.